Hello, I'm Professor Owen Judd. I'm consultant ear, nose and throat surgeon in Derby. So the main causes of chronic cough can be divided into three main areas. They're either the upper airways, so the nose and back of the throat itself, or the area of the larynx and voice box, or the chest. So that's sort of those three levels. So from a cause perspective, the biggest cause that we get concerned about with chronic cough are any problems in the lungs themselves, particularly things like lung cancer. So any patient who has a chronic cough, that is one of the potential causes, which is why, of course, we have advertising campaigns that if you've had an unexplained cough for 3 weeks or more, you should visit your GP. And that's primarily to rule out a potential for a lung cancer or a chest problem. We in ENT see a lot of patients with chronic cough who have problems at the throat level, so either in the voice box itself, and there are many different causes for chronic cough in the voice box, but probably one of the most common is chronic irritation from reflux from the stomach. And then other issues can be in the upper airways themselves, so things like allergy, hay fever, for example, can often give a particularly chronic cough, issues with infection of the nose and sinuses, which can sometimes give excess mucus production, which again can give us a chronic cough. But actually a cough itself can often be a cause of a cough. So every time we cough, we cause a degree of inflammation and trauma to the back of our voice box when our vocal cords bang together very violently during a cough. And we can then feel that irritation and tickling sensation, which will then make us cough again. And it can often become a vicious cycle. So for patients that have been coughing for a long period of time repeatedly, it's often the cough itself that keeps itself going. So why may you continually clear your throat? Well, that's actually very common as well. And in a very similar way to a chronic cough, chronic throat clearing is quite an aggressive action. Every time we clear our throat, so we make the sound, for example, the back end of the vocal cords bang together quite violently. This causes a degree of inflammation between the level of the vocal cords at the very back, which can then be felt as an irritation, which makes us feel we need to clear our throat again. And it can often be set up with that repetitive cycle. What's really common in causing the inflammation at the back of the throat in the first instance, which gives us that sensation that there's something there that we need to clear, is often something known as silent reflux. And this is a really common problem. So the stomach contains both acid and enzymes. If we have too much acid in our stomach contents and we reflux, that's what gives us heartburn and indigestion. But if we have normal levels of acid in our stomach and are still refluxing, we may not necessarily feel it. We don't get that heartburn and indigestion, but it often will cause problems at the level of the throat. And that's because the enzymes that sit in the stomach are there designed to digest protein. And when they reflux into the back of the throat, which is very delicate soft tissues, which of course are made of protein, it will cause lots of inflammation. You then feel that inflammation and it feels like a blob of mucus stuck in the back of your throat. And the natural reaction is to try and clear your throat to get rid of that sensation. But of course, you can't cough up your own throat, and therefore you can't get rid of that sensation completely. But every time you repeatedly clear your throat, you cause more inflammation, which makes you want to clear your throat again. So a vicious cycle is really common with chronic throat clearing in a similar way to chronic coughing. So if a chronic cough is left untreated, as I just mentioned, it will just perpetuate itself. So each time we cough, we cause more inflammation and trauma at the back of the vocal cords, at the back of the larynx, which will make us cough again, and it just keeps perpetuating itself. So we don't get overly concerned by chronic cough being untreated. That's of course a worry for the patients, but what we get concerned about is a chronic cough that isn't diagnosed. So diagnosing the cause for the chronic cough is extremely important, at which point then we can instigate treatment. So if you have a chronic cough and you're thinking of how it's going to be managed, obviously it depends entirely on the diagnosis. So for patients who have upper airways generated cough, so problem with their sinuses, for example, allergic rhinitis or hay fever, which is very common, this can obviously be treated. And most commonly, allergy and inflammation in the upper airways will be treated with topical steroids in the form of nasal sprays or antihistamine medication. So typical treatment for things like hay fever and chronic sinusitis. If you have a problem with allergy affecting the level of the throat, then again, antihistamines are very, very effective. But sometimes if we can diagnose this as a silent reflux problem, which is extremely common and leads to chronic habitual throat clearing and coughing, then treating that silent reflux with anti-reflux medication can be very, very helpful. For patients who have chronic habitual throat clearing and coughing and find it very difficult to break that habit, there are techniques and exercises that we can teach patients which helps them break that habit and can help them with a chronic cough and throat clearing and essentially settle it down altogether. But ultimately, anyone who has a chronic cough, particularly if you have a cough that's lasting for 3 weeks or more and it's unexplained, you need to see your GP to rule out any serious causes.